there, how are you doing today? I'm Chelsea Berry, a student nurse, and I'm here to help you get comfortable with breastfeeding. I have some great information and teaching aids that I'm going to share with you. If you have any questions, please ask. I'm here to support you. So my goal is to help you understand some basic information about breastfeeding, answer your questions, and give you support. We're going to talk a little bit about feeding positions, breast and nipple care, feeding intervals, breast milk composition, and burping. We're also going to talk a little bit about the back to sleep guidelines put out by the American Academy of Pediatrics. And hopefully by the end of this demonstration, you'll be able to tell me a little bit about the benefits of breastfeeding, show me a good burping position, and tell me some reasons for the back to sleep guidelines. I wanted to start off with a positive quote by a famous lactation consultant named Pamela K. Wiggins. Breastfeeding is a mother's gift to herself, her baby, and the earth. There are so many benefits to breastfeeding. Let's just go over a couple. As far as the benefits for mom goes, some major benefits include decreased postpartum bleeding and reduced risk for certain diseases such as ovarian cancer and breast cancer. As far as the benefits for baby, some major benefits include reduced infant mortality and reduced risk for SIDS. Other benefits include that it is less expensive than formula feeding. There are many breastfeeding positions. I'm going to show you 4 positions with the baby doll I have here. The first position is called a cradle hold. I'm going to be using my opposite hand to stabilize my breast and nipple, and the baby's head is nestled in the bend of my elbow. Let's switch to the football hold. In this hold, you use the opposite hand to stabilize the breast and nipple, and your baby's body is nestled between your arm and your body on the same side of the breast you're feeding with. This is a really great position for early breastfeeding because you can see the baby's mouth easily as you guide the baby onto the nipple. The third position is a cross cradle hold. Watch as I use the same side hand to stabilize the breast and nipple. Cross your opposite arm over the baby and hold your baby's head. You and your baby should be tummy to tummy in this position. The fourth position is a side lying position. You're going to use the opposite hand to stabilize your breast and nipple. Lay on your side, and baby lays on their side facing you with a pillow or a rolled blanket behind their back. Again, you will be tummy to tummy with them in this position. Remember, when picking out a breastfeeding position, comfort is key. How do we get our baby to latch? And how do we know that their latch is effective? Well, you can start by manually expressing a few drops of milk and spreading it over your nipple. Hold your baby directly in front of your nipple. You can tickle the nose of your baby with your nipple to stimulate the mouth to open. And when your baby's mouth opens and the tongue is down, quickly hug your baby to your breast. You're always going to want to bring your baby to your breast and not your breast to your baby. So how do you know if your latch is effective? Well, a couple of signs of an effective latch are going to include a firm tugging sensation on your nipple without pinching or pain. The baby will suck with their cheeks rounded and not dimpled. The baby's jaw will glide smoothly with sucking. and you will be able to hear your baby swallow. Again, remember, comfort is key. Let's discuss feeding times. I want to give you some good information here, but I also don't want you to get too hung up on specifics, as feeding patterns vary from baby to baby. So instead of focusing too much on the specific minutes of time spent at the breast, I want you to look more for signs that your baby is finished. Like maybe your baby's sucking has slowed, your breasts have softened, or your baby appears content and may fall asleep or release your nipple. But here are some good patterns to follow. You're going to want to breastfeed your baby about 8 to 12 times per 24-hour period, and for an average of 30 to 40 minutes. That's going to be about 15 to 20 minutes per breast. You can either feed every 2 to 3 hours, or you can do what's known as cluster feeding, where you feed every hour for 3 to 5 feedings, and then have your baby sleep for about 3 to 4 hours between clusters. During the first few days, newborns don't wake up often enough to feed, so you should wake your baby at least every 3 hours during the day and every 4 hours at night to feed. Once your baby is feeding well and gaining weight, you can switch to something called on-demand feeding. This is when your baby determines the frequency. With on-demand feedings, your baby should still get at least 8 feedings per 24 hours. Milk composition comes in 3 stages. The first stage, colostrum, usually comes about 2 to 3 days after birth. It's a clear yellowish fluid that is rich in antibodies and higher in protein and lower in fat than mature milk. It helps your baby establish that really good gut bacteria called flora. The second stage comes between 3 and 5 days after birth. The milk becomes lighter in color, and you're going to notice a sizable increase in your milk production. The third stage, or the mature stage, the milk becomes whiter, and the composition and production changes over time as the baby grows and develops. The concentration of fat gradually increases as well. I want to talk to you a little bit about caring for your breasts during breastfeeding. As far as hygiene goes, you can take a normal bath or shower, but just try to avoid overusing soap because this can cause some nipple dryness. Your bra should fit very well and give non-binding support. You should also avoid underwire. There are really great breastfeeding bras on the market nowadays. Just check out the reviews. Breast pads also help for milk leakage. For sore nipples, mild tenderness is considered normal. If you have severe pain or bleeding, that is not normal though, and it's usually due to a poor position or latch. In this case, try repositioning or relatching, or even seek a lactation consultation. If you have cracked nipples, they can be soothed by wiping away your baby's saliva after feedings, rubbing some breast milk on the nipples, and allowing them to be open to air. A common response to sudden increase in breast milk is sometimes called engorgement. It usually happens around 3 to 5 days after birth. It's temporary and can be alleviated by frequent breastfeedings or pumping and warm and cold compresses. Plugged milk ducts feel like swollen, tender, or firm areas of the breast. This is caused by not fully emptying the breast, and it can be due to either a ill-fitting bra or underwire bra, tight or binding clothing, or always using the same feeding position. If you put a warm compress on it prior to feeding, it can help fully empty it. Mastitis is a breast infection that can cause flu-like symptoms. If you develop a fever, chills, nausea, vomiting, body aches, and a hot, reddened breast, you should seek medical attention. It is treated with antibiotics, fluid, and rest. Now let's move to birthing your baby. Sometimes during breastfeeding, your baby can swallow air, and it can make them feel uncomfortable. But burping can help that air come out and relieve them. This is also a great time to incorporate your significant other in the feeding. In the first position, you just sit the baby on your lap, support their chest with the base of your hand, and cup their chin with your thumb and index finger. In the second position, you lay the baby across your lap, and their belly rests on your thigh. Make sure to hold their head higher than their chest. In the third position, the baby's chin rests on your shoulder and you support their head and neck. All you need to do is a gentle pat or a gentle rub. Why do we put babies on their back to go to sleep? Since the 1980s, sudden infant death syndrome, or SID, has been loosely defined. But there was very little change in the incidence of SIDS in the U.S. until the early 1990s. This is because in 1992, the American Academy of Pediatrics recommended that you put your baby on their back to go to sleep. Between 1992 and 2001, the SIDS rate declined, with the most dramatic declines in the years immediately after their Back to Sleep campaign began. Here are some ways to implement the Back to Sleep guidelines. Infants should be placed for sleep on their back for every sleep until they reach 1 year old. They should be put on a firm sleep surface, covered by a fitted sheet with no other beddings or soft objects, and bumper pads are not recommended. Infants should sleep in their parents' room, close to their parents' bed, but on a separate surface, for about 6 months. Even though it is not recommended that infants sleep on the same surface as their parents, sometimes parents may fall asleep while feeding their baby. Evidence suggests that it is less hazardous to fall asleep with your baby in an adult bed than on a sofa or armchair should you fall asleep. So, pacifiers are kind of a tricky subject. You can consider offering a pacifier at nap time and at bedtime, but only once breastfeeding has been firmly established. Studies have actually reported a protective effect of pacifiers on the incidence of SIDS, even if the pacifier falls out of your baby's mouth. The pacifier should be used when placing your baby to sleep, and it doesn't need to be reinserted once they fall asleep. But don't attach the pacifier to your baby's clothing, stuffed toys, or other objects. Avoid overheating and head covering on your baby. In general, your baby should be dressed appropriately for the environment, with no greater than 1 layer more than you would wear. Avoid the use of commercial devices that are inconsistent with safe sleep recommendations. You can go to the Consumer Product Safety Commission to see the standards for bedside sleepers. Success in breastfeeding is not the sole responsibility of the woman. The promotion of breastfeeding is a collective societal responsibility. This is from The Lancet, and I wholeheartedly agree with this quote, which is why I'm here to support you. Here are some supplies that can help you succeed in breastfeeding. Some birth cloths, nursing pads, a breast pump, some type of warm or cold compress, a nursing pillow, and a nursing bra. Here is a great video summarizing everything we just went over. Let's watch it together. This is a great video showing real moms and babies demonstrating breastfeeding positions. Let's watch. This mom had a couple of questions during the demonstration. Her first question was, if I get mastitis, is it safe to still breastfeed my baby? I answered her question by saying, in most cases, yes, it is still safe to breastfeed your baby. But should you get mastitis, double check with your doctor. Her second question was, how do I know my baby is gaining weight? I answered her question by informing her that she can purchase a baby scale and keep track of her baby's weight gain that way. Upon evaluation, she was able to verbalize 3 benefits of breastfeeding, demonstrate a proper birthing technique, and tell me 2 reasons to follow the back to sleep guidelines. And in this way, we met our goal.